Hey everyone, Josh back here with Fight Bad Medicine. Today I want to talk to you about how you can reverse chronic kidney disease. The purpose of this channel, Fight Bad Medicine, is to arm you with health knowledge so you can fight bad medicine. So when we talk about reversing chronic kidney disease, the most important thing, like any issue, any illness, is diet. So I actually want to use a case study here to demonstrate the power of a whole foods plant-based diet when it comes to reversing chronic kidney disease. So I have a patient. He started out with really close to stage 4 kidney disease. That's end-stage renal failure. In June of 2018, he had a GFR, which is your filtration rate of the kidneys, of 30. Really, really low. If it was 29, it would have been stage 4 kidney disease. BUN, 49. Creatinine, 2.1. Very severe kidney disease. Now, he started eating a whole foods plant-based diet before that, so his kidney function was even worse than this, and this is pretty bad. Now, if you look here at October of 2018, just 4 months later, his filtration rate now jumps to 34. BUN drops from 49 to 34. Creatinine drops from 2.1 to 1.92. Incredible decrease. We fast forward here to January of 2019. Currently, GFR of 38. That's a jump originally from 30 to 38. That's only in a matter of 6 months. BUN, 49 down to 26. 26 is actually within range. It's not optimal range, but he's now within normal range for the BUN. Incredible. Creatinine, 2.1 down all the way to 1.73. So your doctors will tell you, you know what? We do the best we can with kidney disease. We can just slow it down, but we can't reverse it. That's just not true. You just saw these results. The results are just dumbfounding. Just by going a whole foods plant-based diet, the patient was able to improve his kidney numbers incredibly. Who knows what's going to happen in 6 months from now, a year from now, 2 years from now? Is the kidney disease going to be reversed completely? Maybe. But the fact is, he does not have to go for dialysis now. He doesn't have to worry about getting a kidney transplant. Very, very expensive. We can save so much money in healthcare just by going plant-based, whole foods plant-based diet. And the way he did it, he just used this book. It's called Eat to Live. It's by Joel Fuhrman. And this book is a nutritarian diet, meaning we get the most nutrients out of our diet possibly for however many calories we eat. And this is kind of like a real perfect diet for kidney disease if you look at it. So most nutritionists will recommend the DASH diet. So that is pretty good because it does recommend eating lots of fruits and vegetables, limiting your animal proteins, including dairy and meat. It gets rid of soda. But it doesn't go far enough. It doesn't tell you to eliminate animal proteins. And it doesn't really guide you on what to eat that's nutritious for you. Okay, so what happens is with the diet where you're cutting out the potassium, cutting out the phosphorus, you tend to cut out a lot of the nutrient-rich foods, like lots of vegetables that are nutrient-rich. You cut out beans. Usually they tell you to stop the beans completely. So you're not left with many choices, and you're not left with many nutrients. So I think this Eat to Live diet is really perfect. Basically, you can eat as much as you want of any type of vegetable, right? You've got your greens, you've got your peppers, onions, tomatoes, carrots, cauliflower, any of the non-starchy vegetables. You can eat as many as you want. And guess what? You can also have your beans, legumes, the bean sprouts, your tofu, fresh fruits. You can have an unlimited amount of these. I may cut down the beans a little bit just so you don't go over your daily value for potassium. It needs to be a little bit lower for people with kidney disease, but it doesn't mean you need to eliminate these legumes completely. It doesn't mean you need to eliminate these green leafy vegetables completely. You have to remember that there are more components to foods than just your proteins and your potassiums. There's phytonutrients that help in the foods to reduce oxidation, to reduce inflammation. They're super, super important if you want to heal from any disease. Now, you want to limit your starchy vegetables. So these are like your sweet potatoes, your white potatoes. So those are extremely high in potassium. So it doesn't mean you need to eliminate it, but at least it limits it. Avocados, very, very high in potassium. But you don't need to eliminate avocados. You just need to limit it. You're still getting some of the nutrients from these nutrient-rich foods. Raw nuts and seeds, again, very important, especially for omega-3s. Omega-3s are so important for healing the kidneys. You limit your dried fruit. Dried fruit is also high in potassium. So a lot of these foods which are too high in potassium are limited, but they're not eliminated from the diet. The important foods are eliminated. So we're talking about dairy products, any animal products. So we're talking about eggs, cheese, milk, any of that stuff, especially meats. So you're talking about chicken and beef and poultry, fish. You want to limit fish. Get rid of those fruit juices, obviously, and oils. Oils are so tough on the kidneys, just the heavy fat content. And if you go to a functional medicine doctor, they'll tell you, oh, don't worry about it. As long as, limit your proteins, but have grass-fed meat, have your eggs, but pasture-raised. Please, eliminate them. They are not helping you in chronic kidney disease or really in any situation. This Eat to Live diet is really, really the way to go for chronic kidney disease. Now, for supplements, you could definitely do a couple of things. So there's a great supplement from Designs for Health that we carry on the ARC Wellness Center. It's called Kidney Correct. If you have severe kidney disease, you want to take 6 capsules a day, so it's 2 capsules 3 times a day. L-carnitine is really fantastic. There's a supplement, MitoCore, from Orthomolecular, and it contains a good amount of acetyl-carnitine, but it's also multivitamins, so you're getting a little bit of vitamin D, you're getting N-acetylcysteine, you're getting alpha-lipoic acid. All these things help to rebuild the mitochondria, and so that's going to help rebuild the cells of the kidneys. And again, you need to drink enough water. With kidney disease, you gotta drink enough water. You gotta flush things out. So just by using this simple plan, you can have numbers like this. You can improve your kidney disease, not just slow it down. You can reverse this kidney disease. So please don't give up on chronic kidney disease. There is hope. You can reverse it. You just need to be disciplined and follow, this diet. It will work for you. That's the main thing. If you want to take the supplements too, that's fantastic. It'll just add benefit to the diet you're already doing. But the main thing is to go to a whole foods, plant-based diet. Remember, if you liked what you heard today, please hit the subscribe button to get more of these great videos so you can learn to fight bad medicine.